Good morning. It's Monday, March 21st. Welcome to the Morning Medical Update. I'm Alexis Del Cid in for Jessica Lovell. Thank you for joining us on Facebook, YouTube, and now Twitter. COVID has taken quite a toll on all of us. It has deeply affected people who have lost loved ones or been at the bedside of someone who has died. Dr. Karin Porter-Williamson and her team of experts from the Palliative Care Program are here to explain how they help people cope, the treatments being offered, and as we enter year 3 of the pandemic, things are changing. But first, your medical headlines this morning. Women, this is for you. You may have extra protection against severe COVID-19 thanks to your estrogen. Researchers in Sweden found higher levels of estrogen may protect against COVID death. If clinical trials replicate the findings, this might help design hormone-based preventative treatments. They say estrogen directly affects the virus by affecting viral reproduction. How often do you share your memories with your children? Turns out it helps them develop a better sense of their identity and overall well-being as they grow. Researchers in New Zealand say reminiscing in front of your children helps them develop more complete, specific, and accurate memories themselves. It gives them a richer base of memories to use while forming their identities in adolescence. And forget facelifts or even those expensive eye creams and serums. Researchers at the Salk Institute say they're able to reverse the aging process by resetting cells to their youthful states. They say a series of treatments involving cellular regeneration in mice not only improved the skin of the mice, but their kidneys as well. More testing is now underway. And we do have a recall alert for you involving some at-home COVID-19 test kits that you may have in your house right now. So take a look at your screen. These 2 tests you see here are recalled. It's either because they were not approved by the FDA or because they're giving too many false positive results. The recall involves more than 400,000 SD biosensor standard Q COVID-19 AG home tests and the Celltrion Diatrust COVID-19 AG rapid test. Both were sold in stores and online. They were produced from June of 2021 to January of this year. So check the labels, check what's in your closets right now or your bathroom cabinet. You can return them for a refund or you can just throw them out. And now to our discussion. Remember, you can send us your questions on YouTube, Facebook, the Medical News Network, and now on Twitter. And you can find links to those all right here on your screen. We are easy to find and we love getting your questions. But first, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joins us with our newest numbers. Good morning, Dr. Hawkinson.
Hi. Yeah, the numbers looking pretty good. 13 active infections right now, 1 in the ICU, none on the ventilator, 62 in that recovery period. Overall, we've had a total of 816 COVID-related deaths since the pandemic began. Our last death, however, was in the last 24 hours of March 19th and March 20th. And so far for the total, we've had 11 deaths in March due to COVID. In January, we had 55, and in February, we had 46. So we have seen the numbers of deaths go down, which is good, and the number of hospitalizations continue to go down as well.
So are you feeling like, Dr. Hawkinson, I mean, it's hard to ask you how you're feeling because you're a doctor is based in fact, but does it feel like or look like to you that we are headed towards a good rest of the spring into summer? Are we set up for success?
Yeah, absolutely. I think we are. It is looking that way. You know, with the number of infections and reinfections, with the number of those who have been vaccinated, with the number of those who've been vaccinated and infected, you know, we are building up good individual immunity, but I hope community or population immunity as well. But we also know that the virus is continuing to circulate. Overall cases have been going down, hospitalizations have been decreasing, and so have deaths. So those are all good things. We may be in a lull right now, but we also know that there is BA2 that is circulating out there. Still not a large or predominant variant here in the United States, but we know in other countries it is. We know the vaccines continue to offer good protection against hospitalization and severe disease for that as well. But we're also looking to the future and anticipating, you know, when and where that new variant may come up. So again, I think, and we've seen some news stories over the weekend as well. The vaccines continue to offer good protection against Omicron for hospitalization and severe disease. Also look to be very protective against BA2 as well. So to answer your question, yeah, for right now, I think we're being optimistic and thinking we do have a lull and that People are hopefully feeling a little bit better about that, but if you haven't been vaccinated, we would still encourage you to go get vaccinated. And more importantly, get up to date, and if you need that booster, get that boost.
And as you always say, the people who are unvaccinated remain to be the most at risk for severe illness or death.
Yeah, that's completely the truth. And there's a very good graph showing that on the CDC website, just looking at vaccinations, deaths, hospitalizations, and comparing that to unvaccinated people, and that continues to hold true.
And this goes along with our discussion this morning, which is about losing a loved one. It can be excruciating. It is excruciating. And during COVID, there was an extra layer of pain because in the beginning, so many people couldn't be there even in the same room to say goodbye as their loved ones passed. As we now have entered year 3 of the pandemic, there is a group of healthcare workers who have been at the front lines this whole time, helping people and families cope at their lowest points of grief and all the emotions that come with grief. So joining me this morning is Dr. Karin Porter-Williamson, Division Director of Palliative Care. Thank you for joining us. We have Marilyn Parker, a clinical nurse specialist in palliative medicine, and we have Kate Shoemaker, a social worker. Good morning to all of you, and thank you for joining us. This is a pretty heavy topic. Dr. Porter-Williamson, can you explain the difference between palliative care and hospice?
Sure. So, palliative care is team-based care. You're getting to meet a core unit of our team today of doctor, nurse, and social worker. Team-based care that's really focused on helping patients and families deal with the physical, emotional, spiritual aspects of serious illness. And that is for anyone who's dealing with serious illness, regardless of if they're pursuing curative or cancer-directed treatments. When people turn to hospice, they're at a point in their illness trajectory where there may not be good treatment that can go towards the underlying illness for cure. And those folks have also come to the time where they want their care to be focused purely on comfort measures, staying out of the hospital. So palliative care and hospice are very similar philosophically, but for patients and families who are at different points in their illness and with different goals surrounding how they want to approach their illness.
And Marilyn, the palliative care at the health system is different from other places, and you really focus on every person in that family.
Yes, that's true. I think there are a couple of ways palliative care in the health system is different. Dr. Porter-Williamson touched on one where we have these core units that round in the hospital. They're interdisciplinary team-based, very highly trained in palliative medicine. And so that core unit consists of a physician, an advanced practice nurse or registered nurse, and social worker, and we actually round in the hospital together to see patients wherever they're located in the hospital. So when you get a palliative care consult in the health system, what you can expect is this core team visit that then does a comprehensive assessment of all of the physical, emotional, spiritual, psychosocial aspects that go into your care, and then they work with the other teams caring for you in the hospital to develop the best plan of care to try and meet the goals that you have for yourself.
I want to turn to Kate now. Kate, we know the pandemic has kept social workers so busy, and I want to go to you for this question. How has COVID changed how you do your work and how you are able to interact with your patients and families?
Sure. I think at the beginning of the pandemic, we knew very quickly we had to be creative. Part of being a social worker here at the health system and all sorts of other places is you want to work with your patient, your client, and their support system, which is their family. Patients and their families are a huge member of our team around here, and when family members couldn't be at the bedside, that was a huge loss for obviously the patient who needed their support system, but as well as our teams. We integrate the family very smoothly into all of our conversations. They're a big part of that. And so we very quickly had to figure out how to keep them involved if they couldn't be here in the building. And so within the first couple days, of really the pandemic being pretty significant here at the health system, we started testing out technology to be creative and using Zoom to connect our patients and families together. We were testing them out as a team, pretending to be family members to make sure this technology would work. And once it was up and running, we were pretty seamless in connecting family members with their loved ones as best as we could. We knew, of course, they always wanted to be at the bedside, but when we would call them and say, hop on Zoom, we're going to be at your loved one's room here in the next 15 minutes. And it was really incredible how quickly the community and loved ones were able to kind of harness that technology as well. We were Zooming with people in Europe and Asia within the first couple weeks. And prior to the pandemic, we had never used that technology. We were doing phone calls for our family meetings. And there is really something that you miss when you can't see who you're talking to on the other end. And also for patients and families, they weren't able to get a full picture of how their loved one was doing. It's very different to hear, your loved one is very ill, they're on life support, and then to see it are two different things. And we want to make sure patients and families have all the information they need to make the best decisions they could. And really being creative and using Zoom was critical in that. And I think we'll continue to use it, throughout the care that we provide. It's really been a wonderful asset to us.
So many emotions, and both the ladies here on the set, Dr. Porter-Williamson, you're nodding your head yes, Marilyn, you as well. I would imagine there's a wide range of emotions for obviously the family members, but also both of you as you see these patients come in and go from sick to horrible to passing. Is there also frustration when you see cases that it could have been prevented?
I think, my emotions have evolved over the course of the pandemic. At first it was a lot of kind of shock and fear because we didn't have answers about how to prevent it. And then over time, as we developed treatments and vaccines, the emotions came partly from fatigue, as we'd all been caring for patients and loved ones with COVID for a long time. I think last summer was a little bit, we thought it was kind of getting over, and then bam,
Right.
we got hit by another surge, and so that felt demoralizing because we were so tired then going into another surge. I feel like now, right now, we're in another lull that hopefully will be sustainable. I feel like we've worked to develop skills of resiliency just to keep coming to work and doing our best job, and just to recognize that COVID is going to stay with us in one variety or another, and so we need to be able to adapt and just do the work that's in front of us the best that we can.
That was a gut punch to have the summer that we had and feel that we all felt that freedom. I know I did, walking into a store in July and thinking, oh, I don't have my mask on, and then felt like the rug was pulled out from under us. I want to ask Marilyn how caring for COVID patients at the end of their lives has differed for you emotionally, and have you done anything differently during COVID that you're going to take with you in the years ahead that follow?
Yes, that's a very good question. I agree with Dr. Porter-Williamson about how emotions have evolved. It was very shocking at first and a lot of fear, and then I could just feel a sadness and fatigue settle in. It's very difficult to be, with anyone that's passing, especially those who've been so terribly ill from COVID. But it's also an honor, and I very much resonated with what Kate said about the efforts we made to keep families connected to their loved ones in any way possible. And so part of what we've done and did early on is we just made rounds with the iPad and did what we call Zoom rounds. What we found too is that also really offloaded our critical care teams so they could continue to take the care of the critical issues, but we would make sure every day when families wanted to be connected that we were connected in the room so they could see their patient. I had never had an experience where we had to kind of manage the passing of someone's family when they couldn't be there due to illness. So that was a whole different thing that we all had to learn to do.
And that was unimaginable for so many of us until we saw it happening.
Yeah.
Yeah, we spent a lot of time as a team debriefing that and talking about ways to support one another. And, for myself, I found small things that I could do that helped that I will carry on into the future.
What were some of those small things?
I started working, using breathing exercises, during the day, which were helpful. I began to bring a fresh flower in daily, and so I had a flower sitting on my desk.
Wow.
And honestly, I would like to give kudos to our dining services and cafeteria staff. I don't usually go to the cafeteria, but I started going because the ladies and the cashiers would ask you how you're doing and tell you to have a nice day. And they don't do this because they have to. They do it because they cared about us. So I learned to recognize some of those things that were already in place. And so I'm a regular in the cafeteria when it comes to getting
nice.
my Diet Coke
Yeah.
and getting my lift up for the day.
Yeah. Oh, that's sweet. Dr. Porter-Williamson, you were going to say something.
Oh, I was just going to add that, part of our adapting and carrying on what works really well is that we now carry iPads. We can sometimes have multiple iPads out on the floor with us. And we have a faculty member who's been out with COVID, and that person's going to round on the iPad today.
Right.
So, we've learned how to be much more nimble using technology so that we can keep getting our work done. And, now everybody knows to expect. I can send a group text to 6 different physicians or teams and say, we need to do a Zoom meeting and pull together that group of people for an interprofessional meeting. And we've never been able to do that before.
That's really been something that offices and workspaces across the globe have started doing, which is remarkable. I want to get to our community questions because we're getting quite a few of them. And thank you for sending them to us. We're getting them on Facebook, Twitter, YouTube. Isaac writes, I saw recently that the much maligned J&J vaccine has made a comeback with the news that it held up for 6 months against Delta. Is there similar data showing its efficacy against Omicron? I'm going to head to Dr. Hawkinson for this one. And Isaac has a follow-up. If this is right, then if we need a 4th shot, should I make it J&J, even though my first 3 were Pfizer?
Yeah, I mean, these are good, insightful questions. We've seen some news stories, certainly, about published reports showing that the J&J vaccine actually does continue to provide durable and very good protection, especially against hospitalization, severe disease, even protection against infection itself. So, we're going to wait for more of those published studies, and I'm sure more will be out. We know, I was just looking at an article from one of the Cell journals, which shows that you get a good induction of neutralizing antibodies after infection as well, after you've been infected, after you've been vaccinated. Again, continue to have that protection, that boost in that immune system. So it is looking like the Johnson & Johnson vaccine is really a very good vaccine. We'll wait for some more information, though, on whether you need to, number one, get a boost, a 4th dose. If that is true, it may be certain populations, like those over a certain age, or things like that. And then also, what is the efficacy of using, say, that mixed dosing for that boost? Again, no guidance on that right now. If you have received the mRNA vaccines, keep getting those. The recommendation still is, if you've received a Johnson & Johnson vaccine, I believe, to get an mRNA boost. But these are good questions, and I think as this new information comes out, some of those recommendations or guidance may be changed. But overall, it continues to add to the story that we know is true, and that's that these vaccines continue to protect against hospitalization, severe disease, and death. And so even if somebody maybe doesn't want, a vaccine, that Johnson & Johnson vaccine is a good option, getting that first dose and then ultimately getting a boost later on as well. So I think this continues to add to the story and the positive data that shows the impact of these vaccines on our individual health to help protect against going to the hospital.
I have a question from Mary Galligan. Mary writes, what steps are the CDC taking to adjust the reported COVID positivity rates? Reported no, then fewer people are getting PCR tests than are routinely reported. So that's, I think she had a few typos in this, but the PCR tests compared with the positivity rates, what's the CDC doing? Dr. Hawkinson, I'll go to you again.
As far as diagnosis?
I think
guess,
she wants to know if the CDC is adjusting the positivity rate when it comes to fewer PCR tests being taken. Are there fewer PCR tests being taken, though? Do we have
You
that?
know, I think overall testing is down, and so the rate is going to be based on that. The rate is going to be based on those numbers, which they have, those raw data, those raw numbers. Now, there can be extrapolations from that as well, and just understanding that fact exactly, that some people may not be going to get those PCR tests. They may be doing at-home tests. They may be sick and known exposure maybe to family members, and so they aren't testing at all. But that's a good question. But I don't think that they're going to be changing their rates. They can only work with the numbers, the raw data that they're given, and I think that's what they'll continue to do. Now, there will be asterisks there or caveats saying, we know these are the numbers, but we also anticipate that this is probably not a true reflection because of these issues that I've just talked about. But overall, they will present the numbers they have based on the raw data that they get.
I have a really good question for our guests from Joellen McGranahan. What do your guests think researchers of the future would want to know from you? Like if you could ask questions of the frontline workers during the 1918 flu epidemic. I'll start with you, Dr. Porter-Williamson.
Could you repeat that?
It's a good one. It's very...
Yeah.
What do your guests think researchers of the future would want to know from you? And like, what would you have wanted to know from the people who were on the front lines of the 1918 flu pandemic?
Do you have an
Do you
initial
want to take
thought,
that,
Marilyn?
Or Kate in the back?
Well,
I mean, have you ever thought, gosh, I wish I could time travel and find out how they dealt with this? You know, you found emotional ways to deal with things. What would you tell people in the future?
I think the first thing that popped into my head is I would want to know more about how, what information they learned on the backside of the event. So, for instance, after the 1918 flu, you know, for us with COVID, we've learned about the disease as we've gone along and how to mitigate and how to treat it. But then there are other issues coming up on the backside, people that have long COVID, you know, how do people recover from the shock and fear and grief that we've experienced during this time? So I think that would be my question for researchers in the future is, you know, what did we learn from our recovery phase, and how can we use that with the information we learned about the illness to better handle the next situation in the future?
Kate Shoemaker, I want to ask you, you're our social worker. Yeah. Do you have thoughts about this, of things you hope people know in the future or that you wish you would have known if you could have gone back?
Yeah, I think what I wonder about is the effect of mental health across, you know, the world at this point, and trauma, and the effect that families have from losing their loved ones, and what that'll look like going forward. I think we have, obviously, we're not where we need to be with our mental health care throughout the country and the world, but we're definitely in a different place than we were obviously in the 1900s with that pandemic. But I often think about what this effect will look like for years to come for mental health, specifically trauma and medical trauma that families have experienced. Watching your loved one die on Zoom is traumatic, and I hope we've learned something in how to better our care for medical trauma. But that's one thing that's often on my mind, is where will we be 5 years from now? What will our mental health care and services look like in the future?
We're getting a couple of questions. It's kind of the same question in different ways about palliative care versus hospice care. Lynn Painter, Facebook message, just wanting more of a clarification. And then also there are other people who want to know, how do you know what's better for your family, palliative versus hospice? Do you have a choice?
Well, you know, when we think about palliative medicine, that really can be that's a team-based care that's an extra layer of support under all of the providers who are taking care of that person. So, for example, if I have a patient who's in our palliative oncology clinic, our palliative care team in the cancer center is helping to assure that their patient has good pain and symptom management, has really good communication from the teams about what's going on, what to expect, and what they're hoping for the most in their care. And palliative care can happen at any point along the line of a serious illness. When we think about hospice, there are lots of benefits to hospice and that team-based care outside of the hospital. And for people who say they're at a point in their illness where they would say, I would rather all of my care be focused on my comfort as opposed to in and out of the hospital with more testing, workup, and disease-directed treatments. So really, we always say the goals of care drive the plan of care. Mm-hmm. And so when a patient and family's goals move to a place of saying, we want comfort care that's focused on best quality of life without worrying about the hospital, without worrying about a lot of testing and treatment, et cetera, that's where the goals fit with hospice services. Okay. Marilyn or Kate, would you have anything to add? Am I missing anything there?
Well, I would add to that too. Those decisions are really based on all the medical data and evaluations we have about a patient's condition too. So we know a lot about how the physical body functions, and so we get signs from the physical body that the body may be doing something different than we expect, and that's all paired with our medical assessment and then risks and benefits of certain treatments, and so that's how we gather together to make these decisions to help people, with the choices that fit what they're hoping to see happen for themselves.
I have a specific question. It's very specific from Jean. Jean would like to know, and Marilyn, I'll start with you on this. What do you, as a palliative care worker, say to people as they are passing to ease their deaths? Do you have specific things you say, or do you go person by person what you know that would be comforting to them? It's a hard one.
It's a hard one. I have to think about that. I don't think I have any one thing that I say. Part of my practice, and I think part of all of our practices, is we take time to get to know our patients, something about who they are. Mm-hmm. So I try to, if I'm with someone and others can't be there, I try to call out things that are familiar to them and say, I know your family is thinking about you. Your daughter sends her love. We talked to so-and-so on the phone today, and they're okay. I just try to be very reassuring and to let the person know they're very well cared for and that we're there with them.
I can't think of a bigger responsibility than that. As far as when you go to medical school, you're not thinking you're going to be the one in charge of saying the final words to someone. Usually, until this pandemic, it was the loved ones in the room holding their hands. I mean, we all know what we'd want to hear from a parent or a sibling, but you have to kind of figure that all out within a month or a few weeks and know how to ease this tremendous burden. We have a question specifically about social work. So Kate, as a social worker, what types of specific services do you provide to people people might be watching right now and need to access those services? What do you provide to them, and how do they access those services?
Sure. So social work looks different across the whole health system. So in the hospital, our social work services are really to help people navigate the healthcare system. It's a confusing system with insurance and all of that. So we take input from the medical providers, our physical therapists, the family, to try to make sure that when patients are ready to leave the hospital, they have the best, safest plan with the most amount of resources surrounding them. In the clinic, our social workers are often helping people make sure that their medications are affordable, that they have transportation to and from appointments. So it looks very different depending on what part of the healthcare system you're in. On palliative care specifically, we're often working a lot with grief and bereavement support and utilizing our community partners such as Turning Point, Solace House, local hospices who have great bereavement support, and connecting patients and families with those supports to help follow them, as they go through this journey.
I have one final question from our community, from Melanie Lively. Dr. Porter-Williamson, how do you proactively help families deal with the anger they may experience as they've lost a loved one and they're left to deal with others in a society that dismisses or downplays the pandemic as a whole? Wow.
Oh, that's a really great question.
Yeah, it's a big one.
It's a really great question. I know we've all had a lot of emotions as we've gone through this, and that it's very, it is so hard to see folks get sick and pass away when we know it could have been preventable, and so I think how do we deal with that anger? Anger is always hiding another emotion, and so is that anger sadness, and is that anger just wishing there were a different answer? And so I guess how we handle that together as a team is to say, we just want to take the best care of our patients possible, and know that there's a lot of emotion around it, and everybody comes to their time in the hospital, whether it's COVID or something else that's causing them to pass away, where we just say, you know what, you are a human being, and we want to make sure that you are comfortable and have dignity, and then support their families through that and all the emotions that go around it. And when somebody's at end of life, that brings out the very best in people, and it brings out the hardest in families when they have to work through those things. So that's what I would have to say.
Yeah. I want to get some final thoughts from our guests on this topic. Dr. Porter-Williamson, I'll start with you.
I think I would just say we know that COVID's not gone, and it feels like it's not as present right now, but to go back to the basic concepts of making sure that we all have vaccination and boosters, and that we're wearing masks when we're inside, all of the things that we can do to try to extend as long as possible the period of time where the volume of virus in the community is staying down. I think we don't want to take care of you in the hospital from COVID. Right. We really don't. We would much rather, if somebody has to be sick, that they have, a milder version of the illness at home, because we really don't want to take care of you for this reason. We're happy to do it if you show up, but there's a way to not have to see us.
Right. And a big one's a vaccine.
Yeah.
Marilyn, final thoughts?
I don't know if I can build on top of that. That was so well said. But I know I've heard Dr. Hawkinson and Dr. Stites talk many times about, just assessing your environment and taking the proper steps. If you're in a situation that doesn't feel safe, then how can you change that? Usually that's by wearing a mask or creating distance, and get your vaccine as soon as you're able, and stay up to date with your boosters. And as Dr. Porter-Williamson said, we're happy to take care of anyone needing care in the hospital, but we hope that you stay well from COVID, and that these measures are helping you and your family to be as safe as possible.
And Kate, as a social worker with the incredibly important work you do, what are your final thoughts from this conversation?
Yeah, I agree with everything Dr. Porter-Williamson and Marilyn have said. COVID's been really tough for everyone in the health system, and I think when I sit and reflect, I'm just really proud of all the work that everyone's done, the creativity, the kind of togetherness that we've kind of formed here in the health system. I'm just immensely proud. Our physicians, our nurses, our social workers, everyone on the team has really gone above and beyond to care for the community during this really difficult time. And That's one thing I often think about. I do agree with Dr. Porter-Williamson in Maryland about masking and vaccination, and we need to keep those things up. But an overwhelming sense of just being proud of the health system and how we've navigated these past 3 years.
And speaking of navigating, Dr. Hawkinson,
Yeah.
now you're entering your third year
Yeah.
of doing these morning medical updates.
Yeah.
It's a milestone nobody ever expected or wanted to reach, but here we are. What are you thinking on this day?
I think feel like I've aged 5 to 10 years, actually.
Right.
But probably like a lot of people who've had it a lot worse than I have. So, I think this has been a great show. Very hard to discuss topics. Death in the hospital, obviously COVID, the pandemic. All of this is wrapped up. We've had some good, insightful questions from our viewers talking about vaccine. And I think to fully bookend this whole show, just kind of wrapping it up saying, we know disease is still out there. We know that deaths are still happening. We've had a lot of deaths here over the past couple years with the pandemic. We know that vaccines reduce your risk of coming to the hospital and dying. So what we've had here also recently in January, of our 55 deaths there, only one of those patients was fully vaccinated and boosted. In February, we had 46 inpatient deaths. Of those 46 people, only 2 were fully vaccinated and updated with their booster. And so far in March here, we've had 11 deaths. Only one of those people has been fully vaccinated and boosted. And when we do go back and look, those people that have been vaccinated and boosted and have died also have some significant comorbidities, immunosuppression, things like that. So, but the numbers continue to overwhelmingly support the efficacy of vaccination and helping prevent severe disease and death. So we would still encourage, just as we heard, if you're not vaccinated, please go get vaccinated. If you're not up to date, please go get up to date with your booster.
That's so important to provide that
Yeah.
context
Yeah.
when you're talking about people who've passed.
We
Thank
were
you all
talking
for
about
being here.
that a little bit
Right.
before the show about the vaccine
Yes.
rate. So, yep.
And there's a backstory when you see those numbers. Thank you all so much for joining us. Thank you for being here. And if you're at home and you or someone you know is struggling to pay for the funeral of someone who's passed from COVID-19, you can get some federal money to help you. FEMA just launched a new outreach campaign to get the word out. So far, FEMA has written checks for $2 billion to more than 300,000 people who've applied for help. Its reimbursement program covers things like the transfer of the remains, the burial plot, casket, clergy services, cremation, headstone, but it is only for deaths that occurred in the United States. The maximum amount of help you can get from this program is $9,000. March 30th is National Doctors Day, and here's a way you can send a huge thank you to all the doctors in your life. Many of you ask, gosh, how can I show my gratitude? Well, here's how you can do it. Very simple. On your screen right now is a QR code. So you just open the camera on your phone, hover over the QR code. It will take you to email, where you can send a nice note or a 30-second video. Once we get your note or your video, we will share them here on air, and all the doctors will see them. Thank you so much for your support, and thank you for being with us today. Coming up tomorrow, you've heard healthcare is one of the hottest career fields right now, and the University of Kansas health system is growing. 2 nurse career fairs get underway over the next 2 weeks. We're going to tell you what it's like to be a nurse here and what you need to know if you want to apply. We will see you tomorrow morning at 8 a.m.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.